A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, so lovely to see you. Thank you so much for joining us today. And I'm so pleased to be able to welcome Maha Mansour. Maha is a doctor. She is one of our homeopaths on the Homeopathy 24/7 acute platform. And she's joining us today from Canada. Thank you very much for coming to see us, Maha.
Thank you, Mary. I am happy to be with you today.
We are so excited, aren't we? Because you've spent many years as a pediatric doctor, and you trained to be a homeopath and you finished your training, I believe, in 2015. So tell me, what made you decide to want to study homeopathy?
Actually, I moved from Kuwait to Canada in 2012, and I want to shift my career, so I choose something related to medicine as homeopathy. And the most attractive thing in homeopathy that based on the vital force and likes to cure likes. This was very, very amazing for me, and I feel these things in medicine actually, because many diseases in medicine, especially the autoimmune diseases, the cancer, all these, it appears when the immunity or in stressful condition or when the immunity goes down. So the vital force in medicine, it's well proven, and all we know about that. So in homeopathy, it's based on this, and there is the like cures, like also was amazing because for example in medicine, in pediatrics, I am pediatrician. In pediatrics we were treating AGH, the hyperactive baby, with brain stimulant Ritalin, and
Okay,
this
yes.
again, but it goes with homeopathy. But unfortunately, it's not in the minute doses of homeopathy, so it caused many side effects, and the mother and the parents try to avoid. Also, corticosteroid in asthma, allergy, eczema. In pediatrics, we use it many times, and it causes many side effects. I saw obesity, diabetes, even blood pressure, high blood pressure, short stature from repeated use of steroid. I'm wondering why we use this, why we can we can use more safe options like homeopathy.
Yes, yeah, it must have been quite frustrating for you as a pediatrician, seeing those side effects. So after your training, and of course you were probably practicing whilst you were training as well, were you able to integrate and have both medicines together, or was it very strict where you were practicing as a doctor?
When I practiced as a doctor after being a homeopath, actually I should separate, because I am not in medicine. We couldn't use other modalities other than medicine. But actually, I found here homeopathic medicine It's not a single remedy. It's a combined homeopathic remedies, and the doctors write here. It's kids drops. It's for cold, for constipation. This is what I used actually,
Okay.
but everyone here can describe it as a doctor, because they don't know. They know that it's something natural, but they don't know the concept of homeopathy behind it.
Yeah.
The only thing I integrate between the medicine and the homeopathy.
Okay, so we are very excited now, because you're retired as a doctor, as a pediatrician, and you're going to be a full-time homeopath, which is so good news for our community, because it means we have got you full-time. And I know that we're going to have a lot of parents who are very, very excited to have you on board, because you know everything about helping children and about the physical attributes of each symptom and diagnosis. You know about the drugs and the medications that they're being offered, but you also now know about the homeopathic choices and can help people perhaps as well through that medication, stopping having medication and having more homeopathy, because you've experienced that, both sides of that yourself.
Yeah, and also I know the diseases of the children, and the diagnosis, and what makes it critical or serious condition, and not. So I can help the parents, and also I can advise her as both pediatrician and homeopath, not homeopath only. I have I had patient with severe asthma, so I should advise the mother what the problem, how to measure the oxygen saturation, when to go to the casualty, and at the same time I treated her as homeopath, and fortunately it passes without going to hospital. But I know the diseases, and how extent it may be serious or not.
Perfect. And this of course is the help that most parents need, that support that that you can be offering. And I just love homeopathy for asthma and eczema, allergies, because it is so effective. And of course the Western medicine is so harsh. The treatment is so harsh for children, isn't it?
Yeah, and we have actually in my problem in pediatrics, that we have a lot of medicine not allowed before 6 months, and we have many medicine not allowed before 2 years, and we are very restricted in that, and we try to find something natural at that time. So it's also harsh in medicine to choose for children, actually.
Yes, yeah, I can completely understand that. And I had a similar experience when I was working in a refugee camp with the nurses looking after the children, because they didn't want to give the steroids for the young children. So she didn't have anything else she could give. So she would come and ask me what we've got that would be safe for babies. Isn't that lovely that homeopathy is so safe for children of such a young age?
Yeah, it's very amazing. And but sometimes I prescribed arsenicum to a baby, and her mother, he was 3 months, and her mother said arsenicum is very dangerous. But I try to explain to her, even if it's toxic, but it makes in very, very dilute amount that nothing will harm.
It's a really good point, Maha, because a lot of our job is helping parents understand more about homeopathy. It's not enough just to be giving remedies and giving prescriptions, is it? We want to be empowering people to learn about homeopathy and learn why it's different, because of course the whole prescribing is so different as well, isn't it?
Yeah. Sometimes they ask me what you prescribe according it's constitutional or energy protocol, or they ask me in details, and I replied that sometimes we use this, sometimes we use this. It's according to condition, according to the response, and so on. So as you said, we try to teach or let them know more about homeopathy.
Yes, that's right. Because of course, a homeopath has many different tools and different ways of prescribing, don't we? So that we can just pull on the right one for each case. And each case, we would use a different prescribing method depending on how deep the health layers are, what the health history is.
Yeah, right.
Tell us a little bit about a few of your cases. Tell us about something that really stands out in your mind about how you were able to help somebody with homeopathy in a completely different way than you would have used for Western medicine.
Yeah. At first, I usually told my patients that the most important thing is follow up and the peculiar symptoms you said. So I prescribe according to your words, to your observations. So make your observation more precise or more accurate as much as you can, because you guide me. These symptoms and these follow-up guide me to the proper remedy. I had patients before she was 50-year-old, and she has the dribbling of urine or incontinence, and she has dry eyes, dryness of the eye, and she has bloating, abdominal bloating, and gases, and hair fall. And I prescribed according to her personality and constitutional remedy arsenicum. And at that time, she took 2 doses, and she forgot the remedy in Canada and went to Egypt. And after that, after 2 months, I contacted her, and she told me everything is gone after the 2 doses. So and and I forgot the remedy. I don't take. I didn't take except 2 doses, and it covers the whole symptoms. It covers the incontinence, it covers the dryness of the eyes, and it covers the bloating. And this is what amazing in homeopathy, that it's something not related to each other, but it covers each other, all the symptoms. But she told me, my sister has the same condition. Can I give her the same remedy? I told her, no, in homeopathy, it's individualized remedy. So it should be individualized to the patient.
Yes, of course, because you're prescribing constitutionally, which means as well as all of those things, you're also taking into account how she's reacting emotionally, how she keeps her house, what she worries about. All those other aspects helps you find the right remedy. And the right remedy there, so we're talking about hair fall, urinary incontinence, dry eyes, and there was one other thing, wasn't there? Gases, bloating, pain. So it covered the whole body, really, didn't it? Just amazing. And yes, you're right. So somebody having those exact symptoms might have a different remedy, because they would be experiencing those symptoms in a different way.
And this makes the homeopathy more difficult. Actually, I worked as a pediatrician and as a homeopathy. It makes it more difficult because as a pediatrician, if the tonsillitis comes to me, I am in 2 or 3 antibiotic choice, and that's the whole for all children. And also asthma, all these I have limited medicine I prescribe from that. But in homeopathy should research and read and do analysis to pick the proper remedies, and this time consuming and more difficult.
Okay, that's really interesting to hear, isn't it? Because, we just take it for granted that, of course, we can look in our books, we can go on a program, we can put in all of the rubrics, the symptoms and the way somebody describes the symptoms. And then we think, well, actually, we've got to take into account the health history or the family history. So we might choose a different way of prescribing. So we're bringing together so much information, aren't we? In order to find the right remedy. And as well as all that, we're actually asking our patients to think more carefully about how they're experiencing their symptoms. So we're asking them for a lot more contribution as well.
Yeah, that's right.
Yeah, so together we form a good team, don't we? We can't do it on our own because we can't do it without the information from the clients. They have to talk in their own words, don't we? And we use their words to find the right remedy.
Yeah. And the observation, I usually told my patient, observe what makes it better, what makes it worse. It's very important because they don't stress on this subject, and this is the most important in prescribing. So I usually tell them, please observe and let me know by email.
Yes.
It's helping.
Yes. Because, of course, once we've asked these questions, then there will be more observance and they can bring us more information as we go. And because we're not just looking at stopping a symptom happen, we're looking at addressing the cause of the symptoms, then quite often it takes quite a little while to be able to address that original cause, doesn't it? Which means that sometimes people have to take remedies for a longer period of time.
Yeah.
Tell us about, I know that you've got another case that involves a child taking a remedy and it worked so well that she wanted to keep taking it.
Yeah, I had a child, 11-year-old. She was a girl, and she has repeated upper respiratory tract infections, and has had school absenteeism 60 days per year, which is a lot.
Oh my
And
goodness.
usually has fever, fatigue, inactive, wants to sleep all the time after coming back from school. And even her brother, her older brother, told me that she is malingering. She wants to escape school, so she did all that. And I prescribed to her Ciproclinum, and it was a constitutional remedy also. But I prescribed Ciproclinum day on, day off at the start. And the mother called me after 3 days and told me, can I give Ciproclinum daily? Because the day she took Ciproclinum, she was active and well, and the day after not taking Ciproclinum, she's lazy and inactive. And I told the mother, it's okay. And I saw the child at the end of the school year, and she told me that the upper respiratory tract infections decreased a lot, and even if she has it's just one day fever or anything, and the day after she's very well, and no school absenteeism is 2 days from the start of treatment, and she is active. And the problem was how to stop the remedy, because the mother refused to even decrease the remedy.
Yeah.
And I told her that we can wean from the remedy. It's let it day off, day on, to two times per week, then weekly, then monthly. But
Yeah.
she was resisting to stop the remedy. She was afraid that she come back to the same.
Exactly. And it's not surprising, is it? Because, you know, her school attendance went right up. I mean, that's a huge amount. She recovered from illness much faster. It just really increased her vitality, didn't it? And made her stronger. So you can understand they're used to taking remedies again and again. So so why would she need to stop?
Yeah.
It is sometimes, again, it's all about helping people understand why homeopathy is different, and the fact that homeopathy is actually helping the body change its reaction. So we do want to use it in a different way, but it's so interesting. What lovely stories. Thank you so much, Maha, for sharing those with us, because it's so good. And I know that you have got a special interest in allergies and eczema, and of course with your experience with children. Tell us a little bit about that.
Yes, I'm interested. Actually, I found asthma even in my pediatric career. Asthma, eczema, allergic rhinitis is a major issue in pediatrics, and we have many. Even if in every 3 cases, I have one either asthma, eczema, or more, especially asthma. It's very common in pediatrics, and unfortunately, all these the treatment is steroids, either inhaled steroids or oral steroids or cream steroids. It's all treated with steroids, and so this is the most important issue. I found that homeopathy is fantastic. Usually, from the start of my career as a homeopathy, I found homeopathy especially needed or helpful in cases where medicine stopped. It's like pain management, like asthma, because in medicine we don't treat asthma, we control asthma. We don't treat eczema, we control eczema. So there is no something short in treatment. So I found homeopathy is a very safe alternative in these conditions. So I saw a lot of patients with steroid short stature and many complications. While with homeopathy, I found it fantastic in eczema, in asthma, and even in allergic rhinitis. And in eczema, I have many children who has eczema all over their body, or so all over their body. If I use a steroid, it would be a huge absorption, and severe eczema, even cracking, bleeding. So with homeopathy, a lot of patients treated or controlled to a large extent, and some of them completely recovered, and some of them are 80% controlled. So it's very safe and effective. And yeah, I mean, There is a lot of things like itching, like a lot of things improved in not only the eczema, which is very bothering the patients or the children.
We are so lucky to have homeopathy, aren't we? Once you've experienced it and once you've seen it and once you've seen the results, you think, goodness me, I just can't imagine life without this. Everybody needs to know about it, which is, of course, why we're here, helping people learn that we do have a choice in medicine, and homeopathy is something that everybody needs to just find out if it might help them.
Yeah, and this actually what makes me like homeopathy, because I saw the results before. Seeing the results, it was different. After seeing the results, I like it. I like it actually, because I found alternative safe and effective.
Brilliant. Thank you so much for joining us today, Maha. What we're going to do is put your link to your page so that people who are listening can find you and get in contact with you, because I'm sure that there are a lot of people that just want to hear how you can help their children, and to know that you understand both sides of medicine is just such a luxury. Thank you so much for joining us today.
Thank you.
Thank you so much, Maha. It was so lovely having you come and talk to us today about your experiences being a doctor and being a homeopath, and how you work together with children in both categories. It's absolutely wonderful, and we're so pleased to have you on our team in Homeopathy 24/7. And in fact, next week, I'm just going to be talking to you about Homeopathy 24/7. I'm going to tell you about how it was created, why it was created, and where we are now and where we're looking to go in the future. So I do hope you can join us. It would be lovely to see you. Look forward to it. Take care.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.